County Health Department Health Officer Kristen Pluta and WIC program registered dietitian Laura Marks. Kristen and Laura, welcome to the show.
Thank you.
Thank you.
Great to have you here. Today we want to talk about nutrition. So we have a registered dietitian with us for all your questions. I hope I ask your questions today. One that we want to talk about is WIC, the WIC program. That's something you administer and are on top of. So everyone's heard WIC, but a lot of people, and we see it in the supermarket, WIC approved item. But what is WIC?
Yeah, so WIC was created in 1974. It is a federally funded program, and it stands for Women, Infants, and Children. So we serve pregnant, postpartum women, infants, and then children up to the age of 5. And we promote breastfeeding, we provide nutrition education, and we provide referrals as well.
Is it a card, a benefit card that someone gets?
Yeah, it kind of looks like a food stamps card that you would get.
Okay, and how much can someone get in WIC program benefits?
It depends on the food package. A breastfeeding exclusive woman would get the most, but it can go up to about $118 per participant per month.
So I mentioned you can see on the shelves of the supermarket WIC, they put that on some of the items. There's a limit on what are the items someone can purchase with the WIC program, right?
Yeah, so WIC provides just like nutritious foods, trying to meet all of the vitamin and mineral needs for each child or breastfeeding woman or pregnant woman. And so that's why you see the WIC approved signs on your lower sugar cereals or fruits and vegetables or whole grain breads, eggs, dairy products.
So you wouldn't see it on Fruit Loops?
No.
The goal is
Those
really
might be a little too high in sugar.
it's to save lives, keep babies healthy.
Yep.
And is it working?
I think so, yeah. 1 out of every 2 babies born in Michigan are enrolled in WIC.
Really?
So, yeah.
So the assumption is it's for very low income people, obviously not.
Yeah. So about 185% poverty level. So there's different ways that clients can become eligible. Some of them are, if they're on Medicaid, they're automatically eligible. And then we do go by income and if they're at nutritional risk. So.
Kristen, we've talked about this the last couple of times. One of the things our community has and a concern about is the infant health, infant mortality. We're not in the top with our standards.
No, we're not. And so, I came last week to talk about teen pregnancy prevention with, that. But, this is a program that there can be some overlap with, although we're trying to prevent teen pregnancies, we know that they happen and tend to fall into a lower economic status due to lower high school graduation rates and things like that. So, WIC is a program that we administer that offers the ability to support some help.
Because you have certain foods that are WIC eligible, that serves part of education. Well, you can get oatmeal, but you can't get Fruit Loops. We're trying to keep your kids healthy.
Correct.
But that's the goal, is to educate, right?
Yep.
Are there some other things you do, or the WIC program does, in terms of education, other than drive people to the right products?
So we do a lot of referrals. So we work really closely with programs like Maternal Infant Health Program, Early On, Lyle Torrent. We do a lot of work with our immunization department in the health department as well. So yeah, if they come in and they have a lot of needs, we refer them out. Or if they have concerns with their kids being behind or nutritionally, we can refer them out as well.
There's some accountability with the program. The recipients, they have to check in quarterly?
Yes, so every 3 months they're required to do something. So they have their first appointment where we go through income to make sure that they're eligible, or Medicaid, and then we check their height and weight and their iron and their lead levels just to see if there's anything we can educate them on. And then in 3 months after that, we can only issue 3 months at a time. So they'll be required for a nutrition education lesson. And they can either choose to do that lesson online, or they can do it over the phone. They can come into the clinic to do it. And then, so it rotates. So either they have an appointment or a nutrition lesson due.
So you stay on top of it. And do you find that people that are in the program, they are getting healthier, their kids are getting healthier, staying healthy?
Yeah, for sure.
They get it.
Yes.
So by having this requirement where you have to check in every 3 months, does it discourage people? Do they say, oh, you know what, that's okay?
Sometimes, but not very often, because the nutrition education lessons that we have offered online are very beneficial, and they can pick which one they want to do, whichever one applies to them. Say they have a picky eater, they can pick the picky eating lesson, and it'll kind of go through and give them tips on how to help with their picky eater. So.
Yeah, we had a story on yesterday, 23-year-old woman in Great Britain. The only thing she's eaten her entire life is potato chip sandwiches.
Oh my word.
Oh,
Yeah.
Yeah. She needs
You
some
wonder how can someone...
nutrition education. Needs to talk to Laura.
You could probably straighten her out.
I think I probably could.
Goodness, she met with a therapist and a hypnotist. She straightened out.
Yeah. We also have a lot of high-risk clients, so those who are diagnosed with gestational diabetes or preeclampsia, and they are eligible for a one-on-one with one of our dietitians, and we have there's 2 of us. So if they're high risk, they are automatically able to have one of those appointments.
Well, the whole country's aware of the baby formula shortage, and how does that impact your department and how you're serving your citizens?
So WIC signs a contract with formula companies every 5 years, and this was the first time we've signed with Similac in a long time. So it's
Similac?
Yes. So we have a contract with Similac for the next 5 years, but because of the recall and because of the shortages, WIC, the state of Michigan WIC, is allowing clients to use their WIC card to get really any brand, because they can't find necessarily the Similac that they need.
Is Similac an Abbott product?
Yeah.
Oh.
Yep.
And you were seeing shortages, but even back into the fall before it came such a big, just supply chain shortages of formula.
Yep.
From the COVID.
Yeah. And then the recall, and ever since then, they just haven't been able to rebound.
It's got to be scary, especially for moms that can't just jump in the car and spend the day looking around visiting supermarkets.
Right. So they have been allowing us, like I said, the temporary formula options. So if a client calls us and they're at the store and they're like, well, this is the only formula they have, can you please switch my baby to this? And typically we don't, but in that case we do. We switch them because some formula is better than nothing.
So they have to call for permission to switch off the brand?
Depending on the situation. Like all the formulas have their equivalent in another brand. Okay. So like Infamil Infant and Similac Advance, they're like almost one in the same. Mm-hmm. So if they're already on the Similac Advance, they can get the Infamil Infant. But if they want a different formula, they have to call us. It is very confusing.
Well, maybe the shortage is going to change the way that's done. You know,
right.
You might say, "Hey, Abbott, sorry, you screwed up." Breastfeeding, though, you encourage moms to breastfeed.
Yes.
And it's pretty universally accepted. That's the that's the preferred way to get a baby fed in their early months.
Yeah, absolutely. We have 3 breastfeeding peers at the WIC office, and when we have a pregnant woman come in, she is signed up for a breastfeeding class just to kind of give her the ins and outs of what to expect if she hasn't breastfed before. And then they're always there for support as well for the breastfeeding issues. Yeah,
it's hard sometimes for moms. And there have been some societal pressures on moms not to breastfeed. You know, there would be frowns if someone was sitting on a bench at the mall and dirty looks and stuff like that. Hopefully that's not happening
I think
anymore.
it's starting to turn around,
Yeah, hopefully.
thankfully.
Are you concerned that families might be trying to dilute their remaining formula or make up their own formula?
Yes, we do have some concerns with that. We have had some people calling say that they have been doing milk, and we've just been trying to educate clients that if there is a formula that they can find, do that. That's our first option. And then if they can't find formula, we've still been referring to Partial to Girls and Henry Ford, Libby and Lindsay, because they have some formula. And then, we have been saying, please do not dilute formula. Don't give goat's milk or cow's milk, because the babies really need that infant formula.
Yeah, and those two were on our show last week, and they have a Facebook page, Baby Formula Jackson, Michigan, I believe it's called, where you can get resources and help. So we're at the beginning, hopefully, of fresh produce, farm fresh season.
Yeah, Project Fresh.
Yeah, what do you guys do to encourage people using local fresh fruits and vegetables?
Yeah, so our clients, if they have a child over the age of 1, they are eligible for Project Fresh coupons, and they just come to us and we give them a booklet. It's worth $25, and we start handing those out the end of July, and they have to use them by the end of October, and only at the WIC approved farmers markets, because we have some connections with farmers around the area. So.
And the downtown Grand River Farmers Market is one of those.
It is.
And what about the Green Market? Is the Green Market up and running now?
I think so.
I think they run all through the year, but they move it indoors.
Yeah.
So I don't know if it's back outdoors in the parking lot there.
And then we have Sweet Seasons. They're out in Concord, I think. They're one of our bigger ones too for the fruits anyways.
Nice. So what is your favorite summer local produce item that you're looking forward to, Kristen?
I am well, right now I'm looking forward to strawberries, because I am waiting for those strawberries, using up the last freezer jam that I made with my sister last summer. And then I'm a zucchini. I like zucchini.
I love
bread,
zucchini,
grilled zucchini.
Wow.
Yeah, that's my.
It's really easy to grow.
It is.
Yeah, it is.
Yeah.
Yeah,
How
a
about
lot
you,
of it.
Laura? What's your favorite summer?
I gotta go with Kristen. I really like zucchini too.
No kidding.
Yeah, I love zucchini. I make noodles out of it.
Oh, you try to fake people at spaghetti?
Yeah.
Remember, she's a registered dietitian.
That's
who,
right.
Yeah, I've heard some of the things she comes in with.
Yeah.
Well, we're pretty lucky where we live. We've got Michigan's number 2 in the whole nation with the variety of produce grown as a state. I'm a tomato guy, but
Yeah,
I gotta
don't
wait
like
a long.
tomatoes.
No.
No.
Now the strawberries. There's a problem with the strawberry supply right now. Hepatitis. How do you get hepatitis?
We talked about this yesterday. I learned about this. I think not to cause any panic, but from what I have heard about the strawberries, is it was strawberries from a certain area sold between April 25th and 28th or somewhere around there. So unless the strawberries you're getting now should be good. And unless you got strawberries at that period of time from those particular locations and froze them or something. But yeah, it was organic strawberries. Yeah. Yes, they were organic strawberries. But what I know.
Well, I just don't get it. Salmonella I get. I know how that can get. But hepatitis. Do people, like farmer workers, do they have hepatitis, touch stuff, and then it gets?
I don't know.
I don't know about that.
I don't either.
But the peanut butter is a big one affecting WIC
I don't
clients
get
and myself and, all of us.
All
Yeah.
the Jif.
So Jif, it's just Jif, right?
Yeah.
So don't buy Jif.
But even yesterday I heard about the different candies and things like that, candy bars and stuff that use Jif peanut butter.
Oh.
That they're expanding a little bit of that. So keep an eye in the news for.
Yeah, food safety. Food poisoning.
Very important.
It's the worst. Worse than a toothache.
Oh, yes.
If anybody has any questions on WIC, I know your website has got all this information, but
It does.
will you talk to people if
Yeah.
people have nutrition and diet
Absolutely.
concerns? Okay. Thanks for coming in today.
Yeah,
Thank
thank
you.
you.
Our health officer with Jackson County, Kristen Pluta, and registered dietitian with the WIC program, Laura Marks.